Let's begin Mariana's story, a 16-year-old who sought medical help for jaundice. Her yellowing skin appeared during infections or after fasting, but she never experienced neurological issues or dark urine. What did her labs reveal? A total bilirubin of 7.5 milligrams per deciliter with a direct fraction of just 0.4, and both blood count and liver enzymes were normal. Remarkably, phenobarbital therapy significantly reduced her bilirubin, hinting at a benign inherited disorder of bilirubin metabolism. Now let's follow a 22-year-old university student facing mild recurring jaundice, especially under stress or after intense exercise. Notably, he never had abdominal pain, fever, or family liver disease. His physical exam showed only slight scleral jaundice and a normal abdomen. Lab results? Total bilirubin was 3.2 milligrams per deciliter with indirect fraction predominance, and all liver enzymes were normal. Hemolysis was ruled out. Such a pattern often points to a harmless hereditary condition. Our next case features a 30-year-old engineer with intermittent jaundice since adolescence. Episodes intensified during stress or viral infections, but he denied any examination. He's visibly jaundiced with yellow sclera, mild liver enlargement, pallor, and moderate limb tenderness. These features prompt us to connect jaundice not just to liver disease, but to underlying hematologic disorders like sickle cell anemia. Welcome to our focused exploration of Syndrome icterica, the syndrome of jaundice. Guided by Dr. Delamos from UNARP Campus Guarujá, we'll walk through the essential first steps in evaluating patients who present with this striking clinical sign. Why does jaundice occur? What clues in the patient's history and lab results help us unravel its causes? Let's set the stage for a systematic, patient-centered approach to uncovering the roots of jaundice. Jaundice, also called amarellisome, refers to the yellow coloration of the skin, mucous membranes, and eyes. This change signals elevated bilirubin levels above 2.5 milligrams per deciliter in the blood, a condition known as hyperbilirubinemia. But what causes this yellowing? It can point to many underlying diseases, so rapid diagnosis is critical for patient outcomes. The photo of an elderly man with yellow skin brings home the real-world impact of this clinical sign. When faced with a patient showing signs of jaundice, where should we focus our investigation? That's the central question on this slide. Should we look at liver function first, or consider hemolytic processes and biliary tract issues? A systematic approach helps us rule out possibilities step by step, ensuring that our diagnosis is both thorough and efficient, key to delivering the best patient care. Recognizing jaundice visually is crucial in clinical practice. Notice the yellow tint in the eyes, mouth, skin, and even the abdomen across these clinical photos. Each area provides valuable diagnostic clues. Yellow sclera often appears before skin changes, while mucosal involvement can hint at the severity of hyperbilirubinemia. These real-life images reinforce why careful observation is essential for early detection and effective intervention in hepatic disorders. Let's start our journey by asking a fundamental question. What are the causes of ictericia, or jaundice? This clinical sign is much more than just yellowing of the skin. It's a crucial clue that something is happening within the body. Understanding its origins sets the stage for uncovering complex hepatic disorders. So as we explore this patient's story, keep in mind, every case of jaundice has an underlying cause waiting to be discovered. Jaundice can emerge from three main pathways: prehepatic, hepatic, and posthepatic causes. Prehepatic jaundice often results from hemolysis, where red blood cells break down rapidly. Hepatic jaundice occurs when the liver itself struggles. Failures in uptake, conjugation, or secretion disrupt bilirubin processing. Posthepatic jaundice points to a blockage in the biliary system. Each type tells a different story about what's happening inside the body and guides how we investigate further. To truly grasp jaundice, we must first understand bilirubin, the main pigment responsible for its yellow color. Bilirubin is the final product of breaking down heme from hemoglobin and other heme-containing proteins. When the body's system for metabolizing bilirubin falters, jaundice develops. That's why knowing each step of bilirubin's formation and elimination isn't just academic. It's fundamental for diagnosing and managing patients like the child pictured here. bilirubin forms primarily from hemoglobin breakdown in red blood cells. About 80% comes from this process, while the rest is from other proteins like cytochromes. The journey starts with heme converting to biliverdin, then quickly to bilirubin. In plasma, this unconjugated bilirubin binds tightly to albumin. Once at the liver, hepatocytes capture it using specialized membrane proteins. Here, an enzyme transforms it into conjugated bilirubin, making it water-soluble and ready for excretion into bile. After entering the intestine, bile is transformed by bacteria into urobilinogen. Some is reabsorbed and excreted in urine, while the rest becomes stercobilin in feces. Normal plasma bilirubin levels are low. Total